Hello, namaste everyone. My name is Krishnaveni.
And myself, Dr. Rohit, physical therapist.
And I'm a psychologist. Thank you for taking out the time to be with us today on our talk about rehabilitation in neurodevelopmental disorder. We both are working at NeuroGen Brain and Spine Institute, which is based in Navi Mumbai. And we have been working for some time with population of individuals with neurological conditions. And we feel that there is a lot of need for professionals as well as parents and caregivers to get equipped with a lot more information and techniques with regards to rehabilitation, the conventional rehabilitation for professionals while working with neurological conditions. Well, today the series that we are going to have is going to happen on every Saturday at the same time, and we are going to have multiple therapists of different profession, like how Dr. Rohit is a physical therapist and I'm a psychologist. We will also have speech therapist, occupational therapist, special ed, art-based therapist addressing different domains of rehabilitation in the coming Saturdays. And that's going to continue for 7 Saturdays. So today is just an overview of what we are going to be looking at through the coming Saturdays. I see that someone has put that they are not able to hear us. You can just let us know if you are able to hear us. If there's any challenge, you can always put it in the chat in terms of unable to hear. We can always repeat it for you.
We're audible. We are audible, right? Can someone please reply?
Yes. Thank you. Thank you. That is really good. We like when we get some reaction and it helps us to do things a little better. Thank you so much for that. All right. So just to understand, so we have about 19 people who are attending with us today, 19 to 20 people, and the number is going up and down. I would just like to understand how many of them today are professionals. So if you could just type in the chat box and let us know what profession are you from. So that will help us to know how much in detail we may have to go into the topics. So in the chat box, you could just put in the profession that you are from, or if you're a parent or a caregiver, you may definitely put that as well. It will help us a lot more. Okay, I see somebody has raised their hand. Okay, so that you are a parent, right? Okay. All right. So whoever are parents, you may raise your hand. Okay. Thank you. Wonderful. And you may put your hand down, and whoever are professionals, could you just raise your hand, please? Wonderful.
Nice.
Thank you. Great. So we have a group of attendees over here today who are as parents as well as professional. That really helps us. So that means we can go through the whole comprehensive. Yeah. So we're going to be starting with our presentation for today. Yeah.
So we'll start with today's presentation. So today we will be giving an overview about the neurological conditions, about the neurodevelopmental disorders, and then we will give you about some fundamentals of neurorehabilitation, and then how holistic approach is beneficial for the child, for patients. So we will have an overview of all these things. So let's start with the neurological conditions. Okay. So basically, if we see the definition, neurological disorders are medically defined as disorders of the brain as well as the nerves throughout the human body and the spinal cord. So in neurological conditions, we have divided into various categories. So few of them categories are mentioned over here in the screen. You can see neuromuscular. So neuromuscular diseases can be, the examples can be motor neuron disease, muscular dystrophies, spinal muscular atrophy. Then in vascular, if we can see, then there are many types of cerebrovascular accidents like stroke, infarct, hemorrhage, aneurysm, then vascular malformations. If we see trauma-related diseases, you can say there can be head injuries or traumatic spinal cord injuries. If we see psychological issues, then we can have patients like schizophrenia, dementia, Alzheimer's disease. If we see autoimmune neurological disorders, we can have encephalitis, autoimmune encephalitis. Then one more example can be multiple sclerosis. Then in infection related, we can have transverse myelitis, again meningitis, encephalitis, all related to infections. Other neurological impairments, we can have brain tumors, spinal tumor cases, and we can also have peripheral nerve injuries or some neuropathy cases. And then we also have the most important, what we are going to discuss in this series is neurodevelopmental disorders. So this is the most important thing what we are going to discuss in this series. So what is neurodevelopmental disorder? So it is a category of neurological conditions that influence how the nervous system develops, which results in abnormal brain activity that can have an impact on memory, learning ability, emotion, and self-control. So there are different types of neurodevelopmental disorder. So few of them are autism spectrum disorder, as you all know, cerebral palsy, motor disorders, attention deficit hyperactivity disorders, intellectual disabilities, speech, language, and communication disorders, and few neurogenetic disorders. So these are complete array of neurodevelopmental disorders. So depending on the diagnosis, we decide the treatment and we progress further. So now we will give you an overview of neurorehabilitation and some fundamentals of neurorehabilitation. Okay. So what is neurorehabilitation? So it is a program that helps patients with neurological conditions to recover or increase their functionality within their environment. It improves independence, increases the quality of life, and it manages the symptoms. Okay. So if we see the fundamentals of neurorehabilitation, the most important thing in which every rehab professional is working on is neuroplasticity. You may have heard this term a lot, neuroplasticity. But what is exactly neuroplasticity is? So as we all know, the brain has an immense potential to continuously regrow, and it can make new connections if we give proper feedback or stimuli to the brain. So by definition wise, we can say it is the ability of the central nervous system to reorganize, structure, connections, and function, and its response to intrinsic or extrinsic stimuli. So again, I will go through this, very important. Reorganization of the structure, that is your neurons, right? So all of you know neurons. So neurons has a cell body, axons, and dendrites. And the dendrites gets connected with the other neurons. So that's how a synapse form, and that's how the information passes from one neuron to another neuron through the synaptic area, right? So these connections can become stronger, and with research we have also seen the brain has also have potential to form new connections. Okay, so I will again repeat it. It is reorganization of the structure, connections, and functions response to the stimuli what we give from intrinsic and from extrinsic. So the brain function can change dynamically in response to experience, practice, and environment. Okay, so what kind of experience we are giving, what kind of environment we are keeping for the child for the therapy, and what activity we are doing. These all three factors can enhance the plasticity behavior of brain. Okay. So there are few principles. If we follow these principles while giving our therapy or by formulating our therapy, that will be very helpful to see very, very good results. Okay. So there are total 10 principles. So first is use it or lose it. Okay. As the name suggests, you have to use the stimuli. Okay, you have to give feedback to the brain for a particular activity. If you don't do any work or if you don't do any activity, obviously it is going to lose it. So the plasticity will stop, or the plasticity will not happen, and the synapses will die off. Okay, so when we are using it, then only we are going to improve it. That is your second principle. So when you are going to use it, you are going to improve it, and if you don't use it, then you are going to lose it. Okay, so these two things are interrelated. Third principle is specificity. So whatever activities we are giving, it has to be very specific in nature. Okay, so for example, all of us first, we have to formulate some goals, right? Before starting any therapy or anything, right? So based on those goals, we have to break the goals in various aspects. So for example, to achieve walking, first we have to work on their muscle strength. I'm just giving an example. We have to work on their sensory inputs. We have to work on their postural control. So like this, we have to be very specific in what all aspects we need to work on to get the final result. So your program, your plan should be very specific, then only the plasticity will induce. Next is repetition matters. As all of us, we know that in neurorehabilitation, the most important thing is the intensity and the repetition. So as much as repeatedly you can do one activity, the neuroplasticity will show more, the brain will show more plasticity. Okay, it will form more connection, it will form more synapses. So as much as you can repeat, then it gets permanent. So for example, if you repeat an activity for 50 to 100 times, it may not get permanent. It will be very temporary. The child will be able to do it for 1 day or 2 days, but again he will forget. But if you repeat that activity continuously, for example, you have prescribed a child to do a particular activity 1,000 times a day. So 1,000 times that stimuli is going to the brain, so that neuroplasticity will happen. Okay, the synapses, the new synapses will form, and then it will go to permanent change. So for making anything permanent, you have to do a lot of repetition and with high intensity. That is why we say in neurorehabilitation, you have to do very vigorous training, right? Then next is time matters. Yes, so time is very important. In this principle, what is suggests that whenever a patient comes to you, if the patient comes to you early, the plasticity effect is more or is beneficial. But if a patient comes to you a little late, the plasticity will have an effect on that. So it will be little less as compared if you're getting a patient early. So time frame from the injury. So for example, you're getting a traumatic brain injury patient, and you are treating the patient from day one, definitely you will get better plasticity results as compared to if you're getting a patient after a year. So definitely time matters as early as beneficial. Salience matter. What is salience? I'll explain it. So salience, as we all know, it means importance, right? So whatever protocol we design for a child, it should be functionally very much appropriate to that particular child. It should be age appropriate. Whatever activities you are giving, it should be age appropriate. It should be functionally active. The child should get motivated to that activity. If you put a child in kitchen and ask him to do activities, kitchen activities, obviously he will get bored and he will not have that motivation to do. Instead of that, if that child likes cars or like bikes, you can do something with those props, and you can use those props in your therapy, and then the child will be motivationally driven for that activity. So whatever activity you are planning, it should be very much functionally appropriate to that particular child. Then obviously, as you all know, age matters. So the young individual will show definitely better neuroplasticity as compared to older clients. Then there are two things, transference and interference. So what is transference? So transference is whenever you are giving therapy to a child in your therapy center or wherever you are giving a therapy, but the parents are complaining that after going to home, the child is not able to do that activity at home. Okay, so as a therapist, we should have the ability to transfer that activity from home, from the therapy center to home based. Okay, so we have to transfer that activity in the real scenarios. So for example, if we are training a child to get up from the bed, that is supine to sit activity. Okay. So we are putting in the ball, we are putting in bolster, we are putting him in swing to do that activity here in therapy center. But as a child goes at home and when a parent asks them to get up from the bed, he is not able to do that because his brain is not trained to do that activity in that bed. He is trained to do that activity in the bolster, in the therapy ball, or in the swing. So as a therapist, we have to transfer that activity to an appropriate environment where the child can participate in the home also. And the last thing is interference. So what is interference is, suppose for example, you are getting a patient after 2 years of an injury, right? So till that time of 2 years, a child can develop lot of compensatory strategies to for whatever problem he has. For that, he may develop few compensatory strategies. Okay. So when a child comes to you and those compensatory strategies are not at all beneficial to the child, after assessment, you found that those compensatory strategies are not at all beneficial to the child. So how you can achieve a new learning there? You have to de-learn that. So whatever compensatory strategies he has adopted, you have to say, we have to stop those compensatory strategies and we have to start with new strategies. So you should also, relearning is different and de-learning is different. Okay. So we have to de-learn those activities to learn new activities. So these are few basic 10 principles. If we follow these principles in our neuro-rehabilitation, definitely we will get better results, better outcomes, and better plasticity. Okay. So I hope everyone understood this 10 principles. If anyone has any doubt, you can definitely ask or you can write it in the chat box. So I hope you all understood. If you have any doubt anytime, you can definitely ask us. Okay. And we definitely want it to be very much, it should be very much two-way, not one-way. So you can ask questions, you can, interrupt us in between and ask questions. It will be great. We can solve it there itself. Okay. So whatever principles we told just now, so in NeuroGen, in this hospital, what we do is we give a very holistic approach for all our clients. So in neuro-rehabilitation, we have everything under one roof, and that is very important. Okay. So if we say what all neuro-rehabilitation we can have, like we can have physiotherapy, we can have occupational therapy, speech therapy, psychology, behavioral therapy, sensory integration therapy, special education, and also aquatic therapy. Okay. So what basically we do over here is, when we assess patient, all the departments assess a single patient, and then we all sit together and we note down the goals of that particular patient, and we all work towards that particular single goal with different strategies based on our specializations, so that at the end child will definitely get a better outcome. And in this approach, you can see out of these principles, a lot of principle can come, like repetition, specificity, okay, use it or lose it, use it to improve it, intensity, repetition, salience, okay, all these principles will fall if we work together. So that is very important if we give a holistic thing to the patient, so that the client will have a better recovery. Okay. So these all facilities we have, and these all are types of different neuro rehabilitations. So I think now Krishnaveni will start with one activity.
Yeah. So I want everyone who is attending to try and read the color and not the word. So I want you to read, for like the first one, you can, the color is blue, then the second is red. So similarly, I want all of you to try and read the color and as quick as you can do. So I want...
So can someone unmute and...
Yes, somebody I would... Yes, that would be good.
So we can call out the name like that or something.
Can someone volunteer for this, please? You could raise your hand to volunteer for this. Oh, wonderful. So we have Rosemary.
Okay, so we'll start with Rosemary.
Yes. Rosemary, you're unmute. You've been given the...
we have
red.
red.
Yes. So you have the color, not the word. Could you do it for us, please?
Read the color, not the word.
Yes.
red,
No,
no,
red is type.
blue,
Yes.
Yes.
Yes. Continue.
blue,
Yeah.
red,
Mm.
yellow,
Mm.
purple,
You have to be fast.
Faster,
Rosemary, you have to be
faster.
quick.
red.
Mm.
Can I start again?
Yeah.
Yes, you can.
Blue,
Mm.
red,
Mm.
purple,
Mm.
red, blue, no, green,
Mm.
red, purple, no, not purple.
That's fine. That's fine. You're
Brown.
doing well. I like it. I like it. Let's start again. Okay. So I'm also gonna do it with
Yeah.
you.
One more time. Come
Yeah.
on.
Let's try one more time. Blue. Red.
Blue,
Mm.
red,
Mm.
yellow,
Yes.
purple,
Yes.
pink,
Yes.
green,
Yeah.
red,
Mm.
maroon, maroon,
Yeah.
brown,
Yes.
black,
Mm.
green.
Wonderful.
Perfect.
Wonderful, Rosemary. That was really very good. Thank you. Thank you for that.
You're welcome.
I think all of you noticed that how the repetition, what Dr. Rohit over here spoke about the neuroplasticity, right? The more time you practice it, the better you get at it. So the first trial, it was difficult for Rosemary to read what the instruction. I said read the colors, so it was a little challenging for her. First, she started to read out the words that were there, right? And the second term, it got a little better, but then she felt she needed one more practice, and so she took a total of 4 trials to get it right. And this is what neuroplasticity in real life may look like. It's a very small activity, but it helps us understand that how the more number of times you do something, you get better at that. And now I want another volunteer for the next activity. Could you please raise your hand? Anjali. Yeah. Hi, Anjali.
Hello, ma'am.
Hi. So we want you to
Okay.
hold on. I'll just change this. Yes. Now I want you to read the color.
Red, red, yellow, yellow, green, green, orange, orange, gray, gray, blue, blue, black, black, purple, purple, pink, pink, and brown, brown.
Okay, that's great. What was different, Anjali, from the first one to now? You saw Rosemary had to take 4 trials to get that, and what was different in this?
Because, ma'am, name and color are matched.
Right, that's right. Thank you so much. So when we organize the content, like what he spoke about, the specificity, right? Like what is specific? We need to focus on that. When the material that is given in an organized way in rehabilitation can really have more effect, and that is why we as therapists and professionals need to have a very organized thought process when it comes to providing therapy to our clients or our patients, right? The first one was the similar set of words, but the words were in a different color. And that was really interfering with the ability for our beautiful volunteer Rosemary to get that. But we saw that in the second one, when the information is correlating with what is actually given over there, it makes it all the more easier to read without any complications or without any delay. This was just a simple example of why we need to organize our material when we are working with our clients. And as a professional, it's important that we need to keep making sure that things given to our clients are in an organized manner. Moving on, we are going to be talking about speech therapy. We are going to be showing some videos about how speech therapy sessions may look like, and all the other therapy sessions also wherever applicable. But we want you to understand that speech therapy works in neurodevelopmental disorders. Quite, their contribution to these disorders are quite a lot. They may work with speaking, swallowing, for developing oral motor muscles, for sensory challenges, oral motor sensory challenges. So they do a big amount of activities with them that will really help children achieve those independence. We are having some challenge in playing the video. So what we can, we'll come back to the video, or we can always later on try to go through the videos. So speech therapy in neurological condition would be to do prevention in cases or individuals with progressive condition. They try to prevent a lot of challenges that may interfere with the individual's quality of life. They focus on assessing and understanding actual challenges. Oftentimes, speech therapists may refer to an ENT specialist to get a hearing assessment done in the case they feel that hearing is affected and that is why maybe speech has not developed yet. They focus on diagnosing the right the proper diagnosis so that proper interventions can be planned for that. And they work on treatment for difficulties in speech, language, social communication. It also involves cognition, communication, and swallowing. So this is what a speech therapist may do in neurological conditions. Of course, this is not exhaustive. There could be a lot more that they might be doing. Some of oral motor exercises that may help in neuromuscular facilitation include these kind of activities. They may use so many different kinds of tools that really help children and pediatric population to develop better chewing, improve strength of oral muscles, jaw strength, sucking strength, sipping and swallowing. So often when it comes to autism, because we do see quite a lot of children on the spectrum and who are neurodiverse population, we do see that they may have some challenges with eating and swallowing sometimes, or they are very particular about the food type that they eat, and that really brings down a lot of stress onto the family members because they have to ensure that it is only the same kind of food whenever they go anywhere, and it adds on to the stress for the parents as well. So speech therapists can ensure that the children are more receptive to different kinds of food, are able to chew the food better to prevent any other kinds of challenges like constipation or the children's gut related challenges also. Food is the main source of energy for human being, right? I'm going to try and play this video. I'm just going to stop sharing for a minute and then we're going to try reconnecting and then trying to play the video. Just hold on, please. We are going to be just rechecking the video while it's not playing. Please be all right. So there appears to be a small technical glitch and we are not able to add the video. But however, the speech therapist and all the therapists would be discussing all of these with you in more detail with regards to either articulation training or chewing and swallowing. So we will have those professionals also who will be addressing these domains. For now, I would like all of us to just understand about how the therapies may look like, and these may be some of the some of the techniques that they may use. Like for this child, they are working on articulation training. They are, she's giving a physical prompt, and to make the child move his lips in a particular manner. That is something that you can observe in this particular picture. Yeah. Okay. Is everyone able to see our PPT? Because we have a notification here which says that your screen sharing is paused. So we are just ensuring that everyone is able to see our presentation. You could just raise your hands and let us know if you can. Oh, wonderful. So we have 2 participants who are able to see our So they may do a lot of action-based vocabulary improvement, like they may work on verbs, because verbs become a very important part for our children to communicate their needs, especially people on the spectrum who may not have developed sufficient communication skills or sufficient vocalization sometimes to convey their needs. The activities may look anything from blowing activities to activities of attention and concentration to improve the compliance for speech therapy. There can be sequencing depending on sequencing of colors and patterning skill to help them frame sentences appropriately. And what sentences they may use, speech therapists may use a lot of different activities that the children actually like, that can contribute to the child's development as well. This is a child with cerebral palsy, and she had a lot of feeding difficulties, and they they were trying to help the child chew better and swallow better, and this is a quote of that. We will definitely ask the therapist who is specifically trained in this to address more in detail in their talks. This is a chewy tube being used for the children who may have oral motor sensitivity, and you can see that the child is put up in a chair called a CP chair, which helps the child stay put. For children who are completely non-compliant, this is a good way to start. I see that okay, the video is not being played because there is some technical glitch, but if you're not able to see the screen, we are just going to remove and we are going to reshare it, because some people have said that they are not able to see the screen itself. Yeah. So we are just reshared it, and I'm sure that now everybody is able to see it, because it okay. So we are starting because some of you couldn't see the screen. I'm just talking about how the articulation training may look like with physical prompt. And then this is a set of series of activities that a speech therapist may do to develop their sequencing of sentences, developing oral motor muscles, use of action words for better conveying of their needs, attention and concentration, which is a basic repertoire for all our children whenever there is a learning involved. This is a video, this is a picture of a child for in feeding based therapy, where the child may have difficulty in chewing or swallowing, and you can see the therapist is trying to work on the feeding task. This is a chewy tube use. This is for children with oral motor sensitivity who has a tendency to put things in their mouth, who often mouth items around them, and they may use behavior therapists may use this as a displacement or a replacement behavior, whereas the speech therapist uses this to develop the strength in the oral motor muscle and to give the necessary input for the sensory input, especially for mouthing behavior. This is a Z-Vibe. It's a vibrating brush which helps children with oral motor sensitivity. This is again used for children who may have mouthing issues or may have difficulty in articulating well by doing the necessary mouth movements. And we often these tools are used in a speech session. And this is an oral motor massage. The therapist is giving physical input on the jaws and in the surrounding areas around the mouth. All of these helps overall for the child to develop better speech, better articulation, depending on what the challenge the child may face. And when we talk about neurodevelopment, of course, there are children on the spectrum, there are individuals with intellectual disability who may have these kind of challenges, who may have difficulty in articulating well. Then we have individuals with cerebral palsy who may have difficulty sometimes in chewing. Now, all of those speech therapists can handle quite well. Moving on to occupational therapy.
Yeah. So in occupational therapy, if we see the pediatric occupational therapy rehabilitation, so a lot of daily activities, occupational therapist mostly works on the daily activities. So you can see in the first picture, occupational therapist is training the child to do buttoning activity. Okay. Then in the second picture, you can see the child is able to take some object from the shelf. So these activities, they are mimicking these activities which they're going to participate at home, and this will able to improve their quality of life. So then they are practicing some activities for handling small objects. Okay, then so small objects and handling big objects like holding a glass, now removing a peg. So all these activities helps to improve their quality of life and daily living. So they also use a lot of strategies like use of rewards and reinforcement to improve participation in day-to-day activities. So if the child is able to finish a particular activity in a specific period of time, then we will ask the therapist will give them a star, so that they will have a motivation, so that the next time when they're going to perform that activity, they will have that motivation of getting that star and they will perform better. Okay, so solving puzzles, identifying the person, the policeman here, they're identifying different objects. Okay, then we are practicing them the activities of daily living, like this in this picture you can see they are practicing the bathing activity, how a person can bathe, how a child can bathe. So that includes a lot of things. Bathing activity includes the transfer, then it includes how to hold that object, how to hold the shower, then how to apply soap. So all these activities being trained by occupational therapists. So they can also give a daily checklist, a daily routine, like they will make a timetable sort of thing, make bed, get dressed, eat breakfast at this time with some pictures. So they know at what time they have to do what activities. Okay, so then they can also prescribe some splints. Splinting is very important. If they have particular muscle weakness, for example, in this picture, you can see a holding a pen. So they are using one gripper so that they can able to hold the pen with a better grip. So this assistive device helps in gripping. So like this, there are multiple assistive device like a spoon holder. So that will help in the eating activity. So a lot of assistive devices are there which will be prescribed by the occupational therapist, which will again help the child to get independent in the aerials. So teaching different techniques to perform tasks. So you can see they have put a cushion over the bed, over the wheelchair. So the patient is sitting in a wheelchair with a cushion, so that a laptop can be placed over there, and it will be the heights and all will be adjustable, the screen height, the typing, and how the person will type. You can, if you can observe here, they are using one assistive device to type also. So these are all a lot of assistive devices and a lot of positioning techniques. Then environment changes, and then the person can able to perform a particular activity at home. So we also have sensory integration therapy here. Then skills to handle small objects, teaching writing skills. So all these comes under occupational therapy. So social skills training to improve interaction, facilitation in the activities of daily living, teaching adaptive techniques, as I told you, to a spoon holder, to overcome limitation and providing adaptations. So in occupational therapy, we also have very important part or important therapy, I would say, sensory integration therapy. Okay, so sensory integration therapy is used in children with sensory issues, in autism, SPDs, ADHD, etc., who have difficulty in processing the sensory information that is received through different sensory systems. So there are different sensory systems like vestibular, like proprioceptive, touch, tactile sensations, pain sensations. So the children have difficulty in processing this sensory information. So either there will be hyposensitivity or there will be hypersensitivity. So based on the assessments, we have to plan the therapy sessions, and we can give them those sensory inputs in the therapy. So you can see this is also a video. We will show all the videos when we are going in detail in the next series. So after this, we are going to take each and every psychology, occupational therapy, psychology, then physiotherapy in detail in the coming series. Okay, so in that we will explain this in detail.
So this is an activity that an occupational therapist does for children who have
Tactile
defensiveness. Yeah. So they may not like touching certain textures, or they might be seeking a lot of textures. So this can be seen in some of our children as touching the hair of others, touching the wall, touching a certain fabric over and over again. And even for, so they are giving those tactile inputs for the child to reduce those tactile seeking behavior. Pediatric psychological intervention and rehabilitation. So, psychology is basically a study of human behavior. And in specific, we focus a lot on behavior, emotion, and cognition. And all these three domains come under psychological intervention and rehabilitation. So the intervention, before we start with intervention, one major work that the psychology team does is the assessment. That is to understand diagnosis and to formulate the diagnosis, the probable diagnosis, if in case the child or the individual has not been diagnosed before, especially for cases that comes under psychological domains. So individuals with developmental problems usually are assessed in detail along with scales and well-established standardized psychometrically sound scales. This may involve for autism, childhood autism rating scale. For ADHD, it could be corners, and the severity assessment is done. So if we already know if the child is on the spectrum, then we try to understand what level on the spectrum is the child is in at. So DSM-5 is one of the worthwhile used journal that, manual that we use for understanding where the child could be at and to ensure that they are meeting the criteria for all the diagnoses that they are being diagnosed with, right? And when it comes to therapy, psychology provides ABA therapy, parent support, and counseling. Of course, there are more like cognitive-based intervention. Counseling will involve emotion-based. It's very important, especially when we are working with pediatrics, is that the family should always be involved in that. Because a child may not be able to make independent decisions and take the necessary decisions by self. So it's crucial that the family is involved when it comes to pediatric intervention plan. Psychoeducation, which becomes a very important part for families who are getting diagnosis for their children for the first time. One is the diagnosis discussion and what it contains and what it means for the child, starting with why it has been given the diagnosis to where it is, what are the possible scenarios and where do we see the child to be at currently and what are the child's potential and how can the child be as independent as possible. This diagnosis discussion should be done with a lot of sensitivity and compassion, because for the families that are getting the diagnosis for the first time, there can be a huge challenging experience for them. And it's important that the psychologist or the professional who are helping in the diagnosis formulation should definitely be there for the family to help them explain and understand the scenario completely. Goal setting. And this is very important when intervention is being done. Right? If the diagnosis is confirmed, we know the child might have a certain level of severity. What after this? What after this, right? If we want the child to proceed further, goal setting becomes a very crucial part. That means that what is it that I want to achieve in all this rehabilitation? Usually, in rehabilitation, whenever there is, whenever there is a goal set, it helps us know that all the professionals are working towards that. There are so many different departments, and it's important that the goals are very clear. Then parents have to be part of the goal set. And the parents say that, this is what I want to achieve with the child. This is my ultimate goal. Maybe my goal is that my child should be independent, should be able to take care of himself. And that is what we are aiming for, right? Independence when it comes to goals. Independent living when it comes to goal setting, right? For most of our children. In that scenario, it's important that the goal is set. So everyone who are working with the children are working towards the same goal. And that just makes it more better for us to achieve that independence that we are seeking for with our children. Like how neuroplasticity, Dr. Rohit spoke about, is basically around this, when we are very specific where we are headed, we are all the more likely to go in that direction instead of getting distracted here and there. So ABA is basically applied behavioral analysis. It's an application of behavioral principles to everyday situation that will either increase or decrease a targeted behavior. ABA has been a well-established, scientifically proven technique for children on the spectrum, and it helps in one, the reduction of inappropriate behavior. You have to understand that behavior is a part of a child, right? We cannot completely change a person, but an inappropriate behavior that may cause harm to self or to others can definitely be worked on. And that is what ABA talks about. And the second part of the ABA therapy is the skill acquisition. A child to develop the necessary skill set to do things better, using a lot of reinforcement, which can take various forms. And this we will be addressing as we have the psychology part further. So a session of psychology session may look like this, where maybe a cognitive training is going on. The therapist is making sure that the child is following command well, is sitting through the session. You can see the therapist is pointing to on the tray as well as onto where it has to go. It works as a prompt. This helps the child or client who is not able to understand exactly or learn the necessary skill. It breaks down the task for the child, so the child doesn't have a lot of frustration even while learning new tasks. Again, a prompt-based command following based on prompts, and it's important that during most of the activities that parents should also be involved in the session. Psychological testing may look anything like this, where we are making the child do different activities. Maybe we are taking details from a caregiver. The family counseling session may look anything like this, where a conversation is open, honest conversation, and with the parents to help them understand what they want to achieve. A very important part that we do as a psychologist at our hospital is basically motivational workshop for all the patients who are there and caregivers of patients and clients, where an emphasis is given on goal setting, so that every individual who is coming is very clear on what it is that we want to do going forward. And this just makes sure that every one of us are on the same page, and it helps every one of them set goals a little better to achieve what they want to work towards in rehabilitation.
So now we'll start with aquatic therapy, one of a specialized branch what we have in this hospital. So in aquatic therapy, so what we do in aquatic therapy is we do physical activity or exercises in water using the properties of water. Okay, so there are a lot of properties of water which we can use. Like one of the property, as you all know, is buoyancy. So we can use the buoyancy and have facilitate the muscles. So it's use of properties, water properties, to perform activities for restoration, extension, maintenance, and quality of function for adults or children with acute, transient, or chronic disabilities. So after immersing a child in water at chest level, 80% of unloading can be experienced by a child, and hence the proprioceptive inputs can be increased by movements as the muscle experience greater resistance. So in the water, we can also give resistance using the water properties, and at the same time we can also assist the movement using buoyancy properties. So both resistive as well as assistive techniques can be used in the water, and it is very the child who is having sensory issues. A lot of children love water, so when they are inside the water, they perform the activities in much better way. So there are a lot of benefits we have seen with aquatic therapy, especially with autism kids. Like they have reduced the hyperactivity, the eye contact has improved, socialization has improved. Then, so you can see the our aquatic setup is something like this, and you can see a child is able to do a particular activity there. So these are a few activities or setups. Yeah. So it is overall very beneficial for children as well as adults, water-based therapy. So in adults also, it improves in, for example, we can say a cerebral palsy child, it helps in achieving their developmental milestones like head control, like getting up from bed, then walking, standing balance. In all these things, water can be very effective and it can show a very good result. And when we compare it with land as well as, so if you're taking a child in water, at the same time, after that, we have to take in land also. So when we combine both the sessions, we have seen a much more improvement in these kind of children. Yeah, now.
So special education focuses, as the word says, it focuses on education and literacy learning. Oftentimes, our children may have struggles with keeping up the age-appropriate academic level of performance that is required. We do see people on the spectrum sometimes achieving more than their age level as well, but then we do have children who may need a little extra support when it comes to academics. Academics need not always be how the conventional academic sense works. This could be functional academics, that is, activities and learning that are essential for them in their real life. This would mean maybe counting with the value so that the child knows to make monetary transactions in the future. Maybe basics of reading so that the child can read the proper shop name and go to that shop. Colors and numbers and shapes to help the child develop more awareness of his environment. It may work on emotional with intellectual, hearing, vision, speech. So special educators may work towards emotional, behavior or cognitive impairments, or with intellectual, hearing, vision, speech or learning disability. Where the children are gifted, we call them those children who are gifted with advanced academic abilities and children with orthopedic and neurological impairments. Now, of course, with children who are gifted, they may try to hone the other skills as well at the same level using their interest. This is where the child is learning some color shape sorting to help the child learn the environment a little better. Because colors and shapes is what helps every one of us to know what is there in our surrounding, right? My house is this color, the wall is this color, and this just helps our children learn better. Music and art therapy is a complementary rehabilitation therapy that can be done with children, especially when they are very distressed. When we see a lot of behavioral challenges, we may use an art-based intervention to help them cope with their challenges sometimes, or if they, because they are non-verbal sometimes, they may not be able to exactly communicate, you know what, I'm feeling frustrated. And these kind of non-evasive, not non-evasive, like where the activities is not expecting the child to speak, the children are better able to express their emotions. So we may see that children who are very angry may, drum a little more harder. And children who are in a happy days may try and follow the tune of the drumming that we are trying to do. If we are asking the children to scream, and if the child is frustrated, the child may actually scream very loudly. The other child who is in a very jolly mood may actually try to do it in a sing-song manner. These are all good ways for the child to cope with the environment, which sometimes may be quite frustrating for them. Group therapy is a way for the child or the client to learn imitation, waiting for turn, learning to share, and being given a chance to interact in a peer-based group. And this will definitely help them develop more social skills, especially autism spectrum disorder, where the diagnosis one of the diagnostic criteria talks about deficit in social interaction. So these kind of groups where it's structured and where it's monitored will definitely help their social skills as well. We try and give group therapy therapy for the children every week, at least once in every week. Moving on to physiotherapy.
Yes. So now moving on to pediatric physiotherapy rehabilitation. It is a treatment-based exercise and interventions with the goal of addressing functional impairments, including muscle tone, strength, coordination, balance and posture, mobility, and achieving an optimal range of motion. So in physiotherapy also, we do a proper physical assessment We do a lot of assessment of muscle tone, then muscle strength, then we see the balance, static, dynamic, coordination, posture, and then we also see the gait. We do a gait analysis, and after doing all these assessments, we plan a proper goal, and then we try to achieve towards that goal. Okay, so these are the few activities like balance training, then facial exercises, gait training, then transfer training. For in pediatrics, what we want, majorly what our goals are is to maximize the independence, prevent deformities, maximize communication, social and peer interaction. So in physiotherapy, we are also giving physiotherapy to autism children, and that is a very interesting area, because we have seen a lot of autism patient also has some physical issues. For example, they have poor core strength, core muscle strength, or abdominal or back muscle strength. Then they have problems with the flat feet. They have problem with navicular drop or valgoid feet. So we give them foot arches for that. Then we have seen a lot of children are sitting in W sitting. So due to that, there are specific muscle tightness like adductor and hip internal rotators tightness. So we give specific stretching to those muscles. So like that, we have seen a lot of physical issues also with autism kids, and with physiotherapy, with brain gym activities, they really gets very it affects or it helps them a lot. So these are the few techniques.
Yeah. We are coming towards the end of our presentation for the day. Some techniques that I always inform all the new professionals who are entering the field, and also for some of us who have been in the field for some time, who are professionals or parents, is that we need to remember some ground rules, right? And while we want a lot achieved in therapy, it's important that we are patient but firm while training them. We know that we have to achieve our goal, but being patient can help the client feel more comfortable in achieving the goal without any distress, without losing any confidence. And practice is the key. I think it has been emphasized on from the very beginning of the presentation. Using a calm voice. Understand that if you are learning something new, go back to your school days when you went to school and imagine how you felt whenever the teacher shouted at you because you couldn't get something. You're more likely to never reach out to that teacher again for a help, right? But a teacher who has been very understanding and has been calm and has shown that patience towards you, you're more likely to reach out to them, and that is beneficial for your learning actually. And this applies to our children as well. It's always ideal that we use calm voice, because sometimes the voice modulation can also become a reinforcement for our children to either seek attention or to develop the avoidance and escape behavior. Using simple words and phrases, and this we can't emphasize enough, because oftentimes we talk to children like they are adults. Especially the spectrum, individuals on the spectrum, because there is so limited reciprocation from them, we tend to just go overboard on using a lot of bigger sentences. Now, there might be a delay in their processing ability. So, I say a sentence and they may imagine when there was a technical glitch, right? We started playing this. It took some time for you to get the PPT screen on your this. Similarly, our children may sometimes have slow processing. So they heard the word, but they have to make sense of that word. And there can be a small delay in that. And before I even finish the sentence, if I move on to the next one, that can really put a lot of distress in them. And that is why we see that in speech session, children get a lot more frustrated sometimes, right? Definitely a good therapist, a good parent who is well trained to understand their child and the needs of their child can do a lot more better. Being very clear while giving instruction. This is really nice. Like now, I could tell, give me the pen or take the pen, and we would expect the child to still give the pen to us, right? But when I say just take the pen, the child will just take the pen and keep it in his hand and not actually give it. So, trying to be very clear, setting very clear goals and reviewing them regularly. As I said, the final goal is to make the child or the client as independent as possible. in taking care of themselves and taking care of their environment up to their capacity. In that case, we cannot just set this goal and leave it at that. It has to be reviewed at least on a monthly or every 3 months or every 6 months, depending on, of course, what are the goals that you're planning on achieving before that. It's important that just because they have a diagnosis, we cannot isolate them from the society. If anything, in 21st century, everything is about inclusion and giving them an opportunity to be themselves. And we, as caregivers and professionals, have to be advocate for our children and for our clients that we work for. Maintaining confidentiality. Of course, with all the photos that we have shown, we have taken consent of the family members before using them. Using these photos for educational purposes, right? It's important that we maintain certain confidentiality as professionals when it comes to discussion of cases, and without their consent, nothing should be uploaded on social media or any other platforms where the client may not be comfortable with. It falls within our ethical grounds for professionals. Maintaining proper documentation and recording becomes essential for all professionals because it helps you track the progress of the case well, and following all ethical guidelines that are within the purview of your country and your board certification boards. This just makes sure that our practice or our work with these these kind of clients and patients are more smoother and without much challenges. Some things that I always tell for parents and caregivers is to take care of their own mental health. Mental health plays a very important role, especially of caregivers and parents, to help achieve the goals that as rehabilitation professionals we might be setting with them. Right? If the parents are overwhelmed, the parents are feeling depressed, if the parents are feeling anxious, or they are just not in a good mood, all of these could have an effect on the client's ability, especially pediatric, because pediatric children are usually in sync and are in tune with their parents' emotional state of mind. So taking breaks regularly becomes essential. Doing something that you like, it could be a hobby of yours. Planning your day well. Planning goes a long way. When you know exactly what I want to do at what time and what time I'm going to do what activity, even if I'm doing home-based home-based therapy, that can just take the load off your decision making. So you're not going to experience a decision making fatigue. When you have to make that decision every single day, oh, what activity do I have to do now? Oh, what do I do about this now? Right? Taking support. Understand it takes a village to bring up a child. So take all the support that you can take, and it can be your therapist, it can be your teachers, it can be your neighbors, it can be your other family members and relatives, even your even the it's sometimes seen that in certain cultures that the mother has to take care of the child. So even pulling in the father becomes very important when it comes to taking care of the child with different needs. Assigning and delegating duties to everyone at home. So if you're going to be doing therapy with your child, make sure that other family members are doing other tasks at home where you can be free to only take care of the therapy for the child. Making a reliable team of professionals are very important. It's a teamwork because if it's a team that is working together and ensuring that child becomes as independent as possible, that makes sure that there is more success rate for those children. Focusing on the positives, there are going to be a lot of challenging things when it comes to children while developing, when they are growing, when they are developing. There will be different kind of challenges depending on their age. So it's important that while those challenges we have to deal with while we will have to find a solution for those challenges, but it is also crucial to maintain our positive outlook towards. Engage in counseling or support group whenever possible. There are a lot of parent support group led by parents, sometimes by professionals as well. A place where you can share the challenges that you're facing, somewhere where you can share the difficulties of parenting can also ease your mental state of mind. Thank you, everyone.
Thank you, everyone,
for spending your time with us. And if anybody has any question, we can take them now. As we said in the beginning of the talk, is that this is the first part of the seven-part series, seven-part talk series that we are going to be getting in. So we are starting with a complete overview of neuro-rehabilitation in today's talk. In neuro-rehabilitation, we have focused on neurodevelopmental conditions. Going forth in neurodevelopmental conditions, we are going to be talking more in detail about what a psychologist does, what a speech therapist does, and this is going to be addressed by the professionals themselves. What an occupational therapist does. We have an aquatic therapist who is going to be addressing. We have a pediatric physiotherapist who will be helping us understand a lot more on what can be done and what kind of skill sets you may need to incorporate that in your practice. I think somebody has raised their hand. Kate, do you have a question? Hi, Kate. Hi, Mrs. Kate.
Hello. I think you are muted. So
I think there was a raised hand. If you have anything that you want to say, you may say. Okay, I think it's just
Yeah.
All right, we have some questions in the chat box. Okay. Okay, so we have a question over here in the chat box. I'm going to read out the question and we both will try and answer them. Hello, sir and madam. How could we develop the sensory without using any mechanical equipments, only by manually? Okay. Dr. Shahid has Sultan has asked. Yeah. Usually in sensory integration, the use of mechanical equipments can be very limited. They do use a lot of manually done activities and strategies. There are some rules that they follow when it comes to sensory integration. They talk about how our sensory input has to be maintained at an equilibrium, and a lot of focus is given on sensory diet, like how if we want to be healthy as an individual, we need to eat at regular intervals, like every 2 hours, a small meal to maintain your health and maintain your weight as well, right? So in that case, similarly, sensory input when given in short amount of time across the day can really help the child calm and regulate himself and keep the sensory input at an equilibrium. This we will definitely be addressing in detail with a talk on sensory integration and occupational therapy for pediatrics, which will be addressed by the head of department at that time, right? We have.
And you can use simple tools like you don't need any mechanical equipment for giving sensory integration therapy. We can use very simple tools. We can use a lot of light tools also, like torch lights. Then we can use a lot of texture related sensory tools. So you can use tools which are available surrounding you. That can also be helpful for the child. Yeah. So, but in detail, we are going to discuss that in our occupational therapy when we are going to take the sensory integration lecture. Yeah. So the next question is
what guidelines do you recommend for okay, so Juliard Lebenu,
I think caregiver, right?
Yeah, he's a caregiver.
Yeah.
So I'm a primary care physician who works in a setting where there is no much rehabilitation center. What simple therapies can I give to patients with ADHD, ASD? And what guidelines do you recommend? If you have registered with us with your email address, we can share a PDF that has been compiled by our therapist with a lot of different strategy-based activities. Like very activity-based strategies are mentioned in those books, and that is something that we can definitely share with you for, especially autism spectrum disorder. In the case if you have not, please just type out your email and we can send them across to you. Yeah? Can I get those notes in my email, please? Okay. So some of the videos, because it has been only given, we have been only given consent for using it for educational purposes and training. We may not be able to freely distribute it. We may have to make modifications in the PPT by removing the children's, children's face or the picture, and then we will definitely share the PPT with you. We have Glory Edit, who has asked us what can be done for a 17-year-old autistic girl that has never spoken before, and what exercise can be introduced to correct deformity on the left side of the whole body. And I think if there is some challenges with the left side of the body, we may have to evaluate the child a little bit more to understand if there is a presence of other kinds of comorbidity in diagnosis. Maybe with autism, the child also has some other challenges, physical related challenges that may help us understand the concern a little more better. What I would suggest, however, to begin with is to, because 17 years, right, teenage, we should start with simple activities, even some household chores, at least just keeping things, organizing things, because I'm understanding the child has a left side
weakness or deformities.
Yes. Yeah. So is the child able to walk, and all of those also will have to be evaluated. You can definitely message us and email us, and we will be happy to guide you further on this Glory.
But you can definitely do a lot of stretching activities for the deformities and try to give more activities on the left side, so that the child will engage the left side more as compared to the right side. But definitely after a proper evaluation, we will be able to create a protocol or give you a proper guideline for how to reduce the deformities and how to improve their areas. Yeah.
So as I said again, the video, we may not be able to share all the videos, but we will share the PPT with the content in the written content in them. How can you rehabilitate a pica eater in autism? So pica can have a medical cause as well, underlying cause that needs to be checked for you. What we know is pica is usually pica is when the child has some nutritional deficiency in their body. So is it pica or is it just mouthing? So we need to first differentiate between that. If they are mouthing, then it is a sensory related challenge. Then in that case, they need a lot more sensory input to develop the oral motor senses better. But if it is they are actually taking and eating non-edible stuff, then we need to evaluate medically as well to rule out if there is a deficiency in their vitamins or nutrients that could be leading to this. You can also type out the case that you are working with Rosemary and send it to us in our email or where you have registered, so that we can address them.
Yes.
We would love to work on the case discussion with you, and yeah, I'm gonna put down my Mr. Dr. Rohit and my email address here. You can definitely email us with the case challenge that you are having. We are just typing out the email address. So if you have any further discussions on the cases, you can send us more details on the case, and we would be more than happy to help you out in understanding the case. Has everyone received their email address? We can copy paste it.
Chat box.
Yeah. We are just putting our this.
In the chat box we have put.
We are putting the email address in the chat box. Okay. So we have put it in the chat box, our email address. So any particular case you want to further discuss, we will definitely be willing to further discuss. Thank you so much everyone for the time. I know we went a little beyond time, but there were some technical glitches in the middle. But thank you so much for being with us throughout. And I hope that you will also attend the other series that's going to follow. And I think that's going to give you more in-depth understanding of each of these strategies that you can use with them. Thank you so much. Bye. Have a lovely day ahead.